So there's a lot of confusion around Botox for stroke spasticity, and in my experience, when you ask stroke survivors about it, you can get completely different answers. For some people, it was a game changer, and while others, it may have done nothing. And honestly, both of these people are probably telling you the truth. The reason comes down to two things, and once you understand them, the decision to get Botox or not gets a lot clearer. I've worked with stroke survivors in their homes for over 10 years, and the topic of Botox comes up quite constantly. And what I've seen is that some people get a lot out of it, and others feel like it just doesn't do actually anything. And the difference usually comes down to these two things, and one of them actually has nothing to do with the injection itself. So the first thing is that not all tightness is spasticity. So that's the first thing you want to understand, is that Botox only works on the spasticity, not on all of your tightness after a stroke. So spasticity is that nervous system problem that is driving too much tone to the arm, keeping it in a state of overactivation. And that's what Botox targets. It quiets that signal at the neurological level, but a lot of stroke survivors are also dealing with stiffness in the muscles or contractures as well. And this is just where the connective tissue has shortened a little bit and stiffened over time. And that's a structural problem. That's not a neurological one, and Botox won't touch that. So if you have both spasticity and stiffness, which is really common, Botox might reduce some of the tone, but the hand still won't open the way you want because of that stiffness. And it's easy to conclude that it didn't work, but when in reality it actually did exactly what it's designed to do. There's just another layer underneath that spasticity. The second thing is the window. If Botox does reduce your tone, the reduction is temporary, about 3 months on average, sometimes less. Most people aren't told that the window is actually the opportunity and the reason for Botox. When your spasticity is quieter, the limb is going to move a lot more freely, and the brain is going to be receptive to new movement patterns. And that's when targeted rehab can actually create lasting change. Not because Botox fixed anything, but because it gave you a better environment to work in. So if nothing changes during that window, the tone's going to come back and you're just going to be back to where you started. So before you get Botox or before your next injection cycle, there are two questions worth asking. First is what you're actually dealing with spasticity, or is there some kind of stiffness or contraction involved too? Because that changes what you can expect from the injection. And the second question is, do you have a rehab plan ready to go while it's working? Because that window is where the real opportunity is. So if you're not sure about how to answer either of those questions, and that's exactly what a strategy call with me is for. We're gonna look at where you are in your recovery, what's actually driving your tightness, and whether Botox makes sense as part of your plan or not. And I'll give you an idea of what a home exercise plan for you specific to your goals and abilities is gonna look like. The link to book is in the description. It's free, it's a video call, and it's specific to your situation. So be sure to check out that link, and hopefully I'll see you on a call.